little jam session. All right. No, not that. Airway management. We're gonna talk about airway management because look at this color. I customized that because it looks like oxygen. I thought it was cool. That's okay. I take pride in this. Integrates the most complex knowledge of anatomy, physiology, and pathophysiology into the assessment to develop and implement a treatment plan with the goal of ensuring a patient's airway, adequate mechanical ventilation, and respiration of patients of all age. Airway anatomy, airway assessment, techniques ensuring airway. We got it. Yep. External, cellular. Okay, so we have several different types. This is broad's eye view. Let's get into it. Nope, no, yes. Here we go. Introduction. So establishing and maintaining a patient's open airway and ensuring effective oxygenation and ventilations are vital to patient care. Whenever it comes to taking your test, the national test, you are looking, you are looking for the best answer. There are multiple right answers, but you are looking for the best answer. So, you always want to go from least invasive to most invasive, unless they're unstable. If they're unstable, unconscious, then you are go balls to the wall, hit them with the kitchen sink. It is futile to try to stabilize a person whose airway is compromised. The body needs a consistent supply of oxygen. I always go to stories in my head, but we're going to stay on track. Begin with the airway. Airway ventilation compromise will rapidly lead to acute deterioration and death. Respiratory system, this brings in oxygen. It eliminates carbon dioxide. Primary waste products of oxygen metabolism. When you have aerobic respiration, aerobic metabolism, then your waste product is going to be water and carbon dioxide. Vital organs will not function properly if the process is interrupted. So permanent death of brain cells occur after approximately 6 minutes without oxygen. That is how much time you have when someone drowns or chokes or something else. Failing to manage the airway or inappropriate management of the airway is a major cause of preventable death in pre-hospital settings. These are so simple. Throw some more up here. Mortality and morbidity increase due to failure to use basic airway techniques. So, improper performance of techniques, rush to advanced interventions, and failure to reassess the patient's conditions. These are all negatives. Paramedics must understand the importance of early detection of airway problems, cyanosis if they're appearing blue, rapid and effective intervention, and continual reassessment. Also, if they're tripoding. These are EMT rules. Appropriate airway management. We're going to open and maintain a patent airway. Patent means open. Recognize and treat airway obstruction. Assess ventilation and oxygenation status. Administer supplemental oxygen. Provide ventilatory assistance. Steps must be performed in order and bypass steps that do not apply. Wow, we have 350 slides. Review of airway anatomy. The upper airway consists of anatomic airway structures above the glottic opening, the glottis, or the space between the vocal cords. Then you have the tongue. First, the anatomic structure that must be manipulated tends to fall back into the posterior pharynx in unresponsive patients. The pharynx is the muscular tube that extends from the nose to the mouth, in the esophagus, and the trachea. Composed of your nasopharynx, oropharynx, and laryngopharynx. Hypopharynx, the lowest portion of the pharynx, opens into the larynx anteriorly and the esophagus posteriorly. I'm going to have to really drink fluids to get through saying all of these words because they're difficult. Look at this picture. Wow. Nasal cavity. Then you have your hard palate. You have your soft palate. So hard palate, obviously, bone. I can't remember what it's called. Then you have your soft palate, which is, you can actually touch the back of it. Entrance to the auditory tube, so that way you can hear, and your pharyngeal tonsil. So yeah, you got your tonsils up here, and then whenever you have an earache or a throat ache, a lot of times you'll feel it maybe one side or not. It's all connected. There could be an infection going from the throat to your auditory canal. Palatine tonsil. Here we go. palatine, I don't have that anymore. Your uvula is what stimulates your gag reflex, and that's this little thingy right here. I guess when you open your mouth, it rises. Upper lip, yep, we know what that is. Tongue, lingual frenulum. Lingual frenulum. So that is under the tongue. And then your gingiva. No. Oh, vestibule. So this is your vestibule. When people think cool tattoos go, sometimes. Nasopharynx, oropharynx, and laryngopharynx. So let's look at this. You got your, it's like C1. I believe that's C1. Cervical spine 1. Nasopharynx is up here. You can see that. And you got your oropharynx. So this is the mouth. There's a uvula. And then your laryngopharynx. Get familiar with this when it comes to intubating, so that way you have your landmarks and know if you went too far. Lower airway. The lower airway extends from the glottis. Did I say everything important? Yeah, I did. Go back. Lower airway. The lower airway extends from the glottis to the pulmonary capillary membrane. Larynx. Complex structure formed by many independent cartilaginous structures. So it marks the upper airway and ends, and the lower airway begins. The thyroid cartilage. This is a shield-shaped structure formed by two plates that join in a V shape anteriorly in the front to form a laryngeal prominence known as the Adam's apple. More pronounced in men, can be difficult to locate in obese or short-necked patients. Suspended from the hyoid bone of the thyroid ligament, directly anterior to the glottic opening. This is important when it comes to cricotiotomies. This is your cricoid cartilage. This is your cricothyroid membrane. So if we're going to do cricotiotomy, boom, right there. That is your entrance. And once you commit, you're going in. All right, so yeah, look at this for a second. All right. Thyroid ligament. So this is your hyoid bone. This is your Adam's apple. Laryngeal prominence. No, this is your Adam's apple. Hyoid bone. And then your corniculate cartilage is behind the larynx. So this is your shield. Your thyroid cartilage, I guess it's on the outside. I don't know if it's pointing to inside. Oh, no. Aortoid cartilage is behind the larynx, and then thyroid cartilage is in front. And you have your cricoid cartilage right here. So harder than, I guess, skin membrane, but softer than bone. Then your trachea. Cricoid cartilage, you have the cricoid ring. It lies inferiorly to the thyroid cartilage. It forms the lowest portion of the larynx, more prominent in females. Interesting. The cricoid membrane, cricothyroid membrane, located between the thyroid and cricoid cartilage. Site for emergency surgical and non-surgical access to the airway, also known as a cricothyroidotomy. We call it criking. Bordered laterally and inferiorly to the highly vascular thyroid gland. Because this location, paramedics must locate anatomical landmarks carefully when assessing the airway via this site. So, what is our site for emergency surgical, non-surgical access to the airway? Cricothyroidotomy. What is the location? The thyroid and cricoid cartilage. Cricoid cartilage, thyroid cartilage, cricothyroid membrane, access. Wow, look at this picture. So you have your glottis, glottic opening. This is the nearest portion of the adult airway. The vocal cords are located at the lateral borders of the glottis. The epiglottis is located at the superior border of the glottis. Epidermis outside, dermis inside, glottis inside, epiglottis outside. Superior border of the glottis. The ET intubation requires visualizing the epiglottis, the glottis, and the vocal cords before inserting the ET tube. whenever you're intubating and you're pulling, not pulling, it's weird. If you're gonna work out any muscle for intubating, it is your muscle, your shoulder muscle, because you do like a scoop, like you're like, is the hardest thing to explain, but it's pretty much like stick in, push up, like don't break teeth. So this is your true vocal cord, the white. If you can see that, then you are golden, because if you see that, you see everything else. Then you have your epiglottis, that is going to be the top of it. Usually that's what I get is my main landmark. Median glosso epiglottic fold, I guess that's some extra membrane there. Your vestibular fold is the part that is not the vocal cords, and then you have your false cords. Oh no, this is a false cord. What's the difference? So vestibular fold and false cord. So I guess there's a cord that looks like the main cord, but it's not. Then you have your trachea, that is what you're aiming for, and your glottic opening. You also have your corniculate cartilage here, your arytenoid cartilage, your arabetic glottic fold, tubular of the epiglottis, and then your epiglottis. I would reread and go over that 3 more times just now, say each word, because there's a lot of anatomical words in here. So, arytenoid cartilage, let's look for that. Arytenoid cartilage. It is behind the larynx. What was the other one? Thyroid? No. Cricoid? I think that was the only one. Corniculate, arytenoid, arabiglottic, yeah, whatever. And then whatever this is, piriform recess. It is recessed in the back. Okay, trachea immediately descends into the thoracic cavity, not a straight tube, which is key to understand whenever you're placing an ET tube. You're not going straight down. It's not a straight tube. Ventilation and oxygenation and respiration. The respiratory and cardiovascular system work together to ensure a constant supply of oxygen. Nutrients is delivered to every cell. Waste products are removed from every cell. So ventilation. This is you physically squeezing a bag and ventilating a patient. When the patient uses their diaphragm and other muscles, they are ventilating. Oxygenation. This is the process of loading oxygen molecules into the hemoglobin of molecules in the bloodstream. That's like the middle of the process of respiration. There's 2. There's exchange of carbon dioxide and oxygen in the alveoli and the tissues of the body. So internal, I feel like I'm jumping ahead, but internal respiration happens first. When you breathe, you ventilate. Here comes all the oxygen. It's in your lungs. Your lungs, no, my battery's dying. Your lungs take the alveoli, take the oxygen, and absorb the oxygen through the alveoli, and then the alveoli release carbon dioxide from